This message is a call to action now to be an advocate for our pulmonary patients. Hi, my name is Kurt Merriman. I'm co-chair of Legislative Affairs for the Minnesota Society for Respiratory Care. The AERC has launched its Virtual Lobby Week right now. From March 28th until April 15th, we are looking for thousands of emails to be sent by you respiratory therapists, physicians, all supporters of our pulmonary patients, to our congressional leaders to help support the Medicare Telehealth Parity Act. Some of the key points to the Medicare Telehealth Parity Act is that this would allow Medicare pulmonary patients access to respiratory therapists via telemedicine. Currently, respiratory therapy is not able to participate in telemedicine, so this would be a significant change. H.R. 2948 identifies respiratory therapists as a qualified provider, along with others such as certified diabetic educators, PTs, OTs, speech pathologists, and audiologists. Specifically for us, this adds respiratory therapy services as a covered telehealth service under CMS or Medicare. This may open up future opportunities for the respiratory therapy profession outside telemedicine, not only for the profession, but also for the pulmonary patients as well. It also expands the coverage of monitoring of these patients so that a respiratory therapist can actually monitor the patient in their home. It will also expand the originating sites, in other words, where these patients are located. Right now, the telemedicine system is for very underpopulated, small rural areas. Over time, this will expand to larger populated areas so that there's more access for the pulmonary patients. A key date during the whole Virtual Lobby Week is April 12th. April 12th, there will be over 160 respiratory therapists, pulmonary patients, RT students, all descending upon Capitol Hill in Washington, D.C. They'll be meeting with their House congressional leaders, asking them to support H.R. 2948. They'll also be meeting with their senators, asking them to co-sponsor and submit a companion bill on the Senate. I get questions from respiratory therapists that work in the acute care side of things and say, well, why should I participate? I'm not planning on doing telehealth or telemedicine. There's a few good reasons why. The first is that you want to be an advocate for the pulmonary patient. Getting that word out and allowing them to have access to a respiratory therapist can help reduce hospital readmissions, which we're all trying to accomplish in all venues of healthcare that we work in. Another reason is that this would be the first time that Medicare or CMS would recognize respiratory therapy as a qualified profession and reimburse for our services. This may open up future opportunities beyond telemedicine that would be important for our pulmonary patients as well as our profession. The call to action is simple. Go to the AERC website, go to the MSRC or your state website, click on Advocacy, Capital Connection. It'll bring you right to the Capital Connection website. From there, you simply choose, are you a respiratory therapist, a physician, a patient caregiver, somebody with pulmonary disease, an interested party that supports the profession. Click on that. It will populate an email that's appropriate based on your selection. You can modify that email if you like or send it as is. Identify what your zip code is. It will automatically populate and send that email to your congressional leaders, even if you're not sure who they might be. Sign it, click it, submit it. It takes less than 2 minutes. You can be an advocate. Our patients with pulmonary disease need your assistance. It is so simple. Our patients deserve your help. Please act now.